So the Vancouver School Board has decided to make masks mandatory for those kindergarten to grade 3. CDC report out of the United States showed that schools that do not have a mask mandate from K to 12 are 3.5 times more likely to have COVID cases, or have COVID cases at 3.5 times a higher rate than those that do have a policy in place. Why will British Columbia not put in place a province-wide mask mandate for students K to 12?
Yeah, so as you know, we do have a mask mandate in our schools, and I think you can't directly compare the report that came out of the CDC that looked at communities and schools without mask mandates and a number of other factors that are protective factors. So I think it is really important to remember that we still have many layers of protection in place in our schools, and masking is one of those layers. We talked about it today, how important it is to monitor every day, that daily symptom check. The fact that we are, while we don't have the same concept of cohorts as last year, there are limitations in intermingling between classes in different grades. Those are important factors. The ventilation that we've been paying attention to, the way classes are situated. And of course, we have to remember as well the before and after school mixing that happens in school-age children. So all of these things are important. And, you know, I showed the data today. We are seeing increased cases in school-age children. That means that school-age children, some of them will be coming to school with COVID. We know that the things that we need to have in place in schools to prevent transmission in the school setting are myriad. And I have tasked, as I said, our school team that works together. They meet 2 to 3 times a week to look at every individual situation, and particularly look at those communities where we have higher transmission rates and lower vaccination rates, to see what we need to do in the province to make sure we can make schools continue to operate safely.
Richard, do you have a follow-up?
Do we have any sense of how many of these cases among children are connected to parents who are not immunized? And on another topic, what is British Columbia planning on doing for a third dose potentially for those who have mix and match or AstraZeneca and may have problems traveling? There are a number of people, I'm sure you've seen the emails, concerned about limitations of where they can go based on what vaccine they have received. Is British Columbia going to provide an additional dose so that people can more freely travel based on international guidelines? Yeah, so in terms of school cases and children, the cases that we're seeing are much more likely to be from families where adults in the family are not yet immunized, or to be exposed in settings where there are older children or adults that are not yet immunized. So yes, it is important. We see in the data I showed today, it shows you on an even a bit of a community level where vaccination rates are low, rates in children and rates in adults are higher. So that's important, and the most important thing we can do to protect our schools until we have vaccination for all school-age children, and we're preparing for that as soon as we can, is to make sure that all of the adults and the older children in those settings are protected. In terms of the vaccine mix and match schedules, and whether it's Pfizer, Moderna, Pfizer, or AstraZeneca, these things are in flux around the world. So no, we're not systematically requiring or providing people with a third dose because we know that these are changing. We know that the U.S. regulations are changing, and it's not that people are prohibited from traveling, it's that they may have restrictions on the things they can do when they travel. And those are things that we are working very hard across the country, but also with our counterparts at WHO, with the U.S., the CDC, to make sure that the evidence that I showed today of how effective these schedules are and how protective these schedules are gets shared internationally and leads to us having a more harmonized approach to how we
to how we allow immunization schedules to be used as proof of vaccination around the world. So these things are changing. They're changing sometimes day by day. We know that. And what we need to do is continue to be protected in where we are here. And we're not systematically providing a third dose for people just because of their desire for international travel.